We're on level 2 of the lockdown. I imagine there'll be some places that will be quite whizzy tonight as the sale of alcohol is legal for the first time in 5 months. Taverns, restaurants, they'll probably be humming this evening. But there are also important warnings about what we don't want to have, what's called a second wave of the coronavirus. Dr. Jabulani Ncayiyana is from the Division of Epidemiology and Biostatistics at the School of Public Health and Family Medicine at UCT. Dr. Ncayiyana, good afternoon to you. Thank you for your time. Firstly, how worried are you, or how worried do you think we need to be that we might have a second wave of this disease?
Thanks, Stephen, for having me. Good afternoon. Yes, it is a big concern. And as you know, like as of today, we have relaxed the restrictions. That means more people are interacting, going out, alcohol and is on sale. So those are the concern that people may become complacent and forget to stick to the prevention measures of physical distancing, wearing a mask, and hand hygiene.
Okay, so if everybody did what we're being told to do, if we all wore a face mask every time we left the house, we kept it on, and if we didn't gather in too large groups and practice social distancing, would that mean that we would not have a second wave?
Yes, because those are the measures we currently have. So in the absence of the vaccine, hopefully it will come. But at the moment, those are the only measures we have to bring this virus under control. And we need to understand that the relaxation and the opening of the economy and other activities doesn't mean that we should then relax and let our guard down in terms of using these measures. In fact, it actually requires us to be more vigilant as we going to be interacting with more people. We're going to be visiting families. Again, we need to be maintaining these measures.
To put it another way, level 5 was the easiest level of lockdown to stop the virus from spreading. Level 4 was harder, level 3 was harder, level 2 is harder still to stop it from spreading.
That's absolutely correct, the way you have captured it, Stephen. So the level 5 made it easy because we were restricted in our movement, we were staying at home. And now level 2, more movement, more interaction with people. So the responsibility falls more on individuals keeping those prevention measures. Physical distancing, wearing a mask, and hand hygiene.
Dr. Ncayiyana, I can just imagine the argument on the WhatsApp groups, the epidemiological WhatsApp groups that you must be on about this. Do you think it was premature to go to level 2?
No, not really, Stephen. Remember, it's a balance between public health and economy. Of course, keeping the restrictions high, it's not really sustainable. So I would say it was not premature as we started seeing the cases going down. But however, on the public health point of view, it's a concern if people are going to confuse the relaxation of restriction with thinking that the virus has gone. The threat is there. In fact, like I said, it's going to be much higher as we're going to be seeing more people interacting more.
Okay, as I understand it, as an epidemiologist, very slowly explained it to me, thank goodness. There's several bits of data that you look at, right? There's the simple testing numbers that we get every night released by the health department. That even I can understand. We've got the excess deaths, which is the difference between the number of people who died during this period in the past 10 years and the number of people who've died in this period in this time. And then we've got hospital admissions, so whether more and more people are going to hospitals. And then we've got deaths, right? So people who die in hospitals. There's positivity rates and other things we can look at as well. What would be the first of those indicators, and any that I've missed, what would be the first indicator of a second wave?
Yeah, so what we need to be monitoring closely is the positivity rate. As you said, Stephen, so the daily numbers fluctuate quite a bit with testing numbers as well. So to look at those numbers can be misleading. So the positivity rate is a more informative indicator because it tells you out of the test you are doing, how many of those come up positive. At the moment, the positivity rate is going down. It's below 20%, and in the Western Cape it's even lower, showing that the transmission is slowing down. So those are the indicators that we need to be looking very closely, monitoring very closely, because the daily cases can go up and down quite a bit. So and may not tell you much.
Okay, so on our sort of dashboard of indicators, that's the one we need to mark in red and check hour by hour. Okay, I think I'm with you. Okay, Doctor, thank you. Other countries have had a second wave. So the United States, I mean, is the best example of this. We all understand how politics got involved. I mean, I don't know how a country in today's day and age has an argument about wearing face masks, but we should congratulate them, they managed it. What led to such a big second wave happening
there? Most of the public health experts and epidemiologists are arguing that the U.S. opened really early. In fact, if you consider that actually the U.S. didn't have a hard lockdown like we did, like a really stringent lockdown. So they had a stay-at-home sort of mandate. So their lockdown to begin with wasn't as restrictive as ours, and also they didn't wait until they were seeing cases going down, so they opened too early. And of course, the mask is not mandated in certain part of the country. So it seems like in the U.S. there is no unified sort of response. The states can decide what is good for the state. So those are some of the things that you observe across there that may be contributing to the second wave.
Okay, and again, you're the expert, not I, but I mean, if we look at what's happening in New Zealand, for example, they went the opposite way. They had a very hard lockdown. They went 100 days with no new cases. Then suddenly one family of 4 people had the disease. Auckland, as we speak, is under a lockdown, tighter lockdown than we are now. And this leads me to another question. I realize this is intensely complicated and gets into arguments about lockdowns, but I can imagine the argument might go that actually until a certain percentage of your population have actually had the disease is always going to move around. People who say that, sometimes they do have a political motive. Are people who say that wrong? I mean, is New Zealand just destined to have the disease no matter what?
Yeah, well, yeah, so the disease, it doesn't go away, and you can bring, I mean, the New Zealand is the best example of how to do it right. So they locked down quickly, it was very hard, and they waited until there were very few cases, and they reopened, and they had no cases for a long period of time. I think they didn't have cases over 100 days, and then it came back again. Yeah, so it just shows that even if you have it under control, the opportunities of the virus to come back into circulation into the community and the population is always there.
There'll be some people who will make various claims about the virus, that it's dead, that it's getting weaker, or that it's mutating and getting stronger. Is that a possibility? I mean, what does that mean from an epidemiological standpoint?
Yeah. So there's some preliminary reports indicating that it may be mutating. That study has not been peer reviewed yet. It's a concern because it affects how the virus is transmitted. It may be more virulent. It may be more transmissible. But at the moment, we don't know what that mutations going to mean going forward. It's still early to know.